Welcome back. In the last module, you learned how to create your bulletproof cheat sheet that will guide you through your exam and will save you from any moment you might feel lost. In this module, you will learn how to use all the information collected so far on your cheat sheet to give yourself the best start in front of the examiners. You will look confident and prepared, but also honest and down to earth at the same time. Once you perform the presentation in the way I show you, you'll be ticking several performance indicators even before meeting your patient. These will make you feel awesome. I can't tell you how good it's going to feel. Let's get into it. The examiners will come in, and just like that, you need to start talking fast, loud, and clear. Fast because there's nothing really to think about. You've put all the information you need in the patient sheet and the cheat sheet. You've already done the mental work, and you just need to make sure they know that you know. There's lots of information that you need to share with them, so there's no time to waste. Loud because you need to own the room. Talking with confidence will give a very good impression to the examiners. You're not there to second guess yourself or be scared or nervous or uncertain about what to do with your patient. You've seen and helped hundreds of patients in the past. This is just one more on the list, just all in a day's work for you. Ordinaria amministrazione, pratica standard, call it the way you want. Easy. Clear, so that there's no chance for you to leave any detail unnoticed. We already mentioned how important verbalizing is in this exam. You cannot take for granted that the examiners will understand something from the way you act, behave, or use your body. You need to verbalize everything that you want to do. Anything you're seeing, anything you're actually thinking or doing, or anything you didn't have time to do. Start from the top of the patient sheet and mention all the details you recorded about them. Once that is done, grab your cheat sheet and read from the top and get to the bottom, following the dot points or arrows if you drew any. You can be quite schematic and repetitive with your vocabulary. It doesn't really matter, as long as the information is shared. For example, I will check balance. I want to check the strength and range of motion of the right knee, and the left ankle, and the left knee, and the left hip. When you talk through the cheat sheet, I want you to link its items to the patient's file, to any expectation you might have, or to any post-surgical protocol if you are in a post-operative scenario. In fact, linking what you are saying to the information you gathered in the patient file will sound very professional. For example, you can say, we already know from the file that the patient is limping, so I'll assess the gait. Or maybe, the doctor has prescribed pain medication to this patient, so we want to know how the pain is and if the medication is helping, or if anything else is helping, or what aggravates the pain. However, whatever the order you use or the links you talk about, make sure that by the time you reach the line that divides the two halves of your cheat sheet, you've mentioned most items that you've written down. You mentioned some of the Woxnor or medication while reading from the patient sheet? Awesome! Just make sure you fill the gaps and mention the rest when you talk about the interview you're going to perform. While I'm talking through the objective assessment part of the cheat sheet, same instructions. Read it out. I wouldn't necessarily list all the directional movements that I want to test. It's a bit time-consuming. Actually, by the time you get to the exam, you might prefer even to avoid listing the direction of the movements on the paper. Probably you'll be writing down the joints only because you'll have trained so hard, you'll know all these details by heart. But once again, you literally just need to read the list that you prepared earlier, if that makes you feel more comfortable. When you reach the outcome measure section, make sure you address them in relation to your expectations. Again, you might have already mentioned what you expect from the patient situation, but this is the moment to truly verbalize it. You can use sentences structures like, from what I gathered from the patient file, I would expect reduced pain to be one of patient's main goals. Or maybe, considering the stage of their recovery, I can expect range of motion to be limited, so we might work together to improve it. If you talk through the cheat sheet thoroughly, you've already ticked all the boxes for a good presentation. Now it's time to really astonish your examiners. Now, the additional words that I ask you to write at the end of the subjective session come to use. I'd like to use these words during the whole presentation, but if you haven't had any chance yet, now it's the time to really get them out there. You can use some standard sentences like the ones I'm going to give you, but if you're sure you've mentioned them already, you're fine. Acknowledge and share referrers' goals. Example: the surgeon asks us to wean the crutches and work the close kinetic chain exercise. So I'd really like to start from that. Priorities. From the file, it looks like our patient is mostly having issues with lifting the arm overhead, so it'll be one of our priorities. Modifications. From the referral letter from the GP, I'm quite concerned about the level of pain. We might have to modify the assessment if the patient is not really coping well. Safety. We'll ask the patient if they're feeling safe about the way they're moving around the house. Influencing factors. I'm not sure whether the chronic knee pain is a factor influencing her recovering from the hip surgery, so I'll ask about that. Referral. The patient seems to be going through quite a difficult situation. I'll consider whether a referral to a psychologist might be useful. As you practice with your friends and colleagues, you must include this type of sentences to become totally familiar with the vocabulary. Well done, you have done it. But please do not rush and get off that chair, because here it is. This is the first time for you to yell, pause, pause, because I want you to have one last look at your sheet and make sure you've talked about all the items you've written down. I know you've been reading from it for those whole 5 minutes, but I'm teaching you to be bulletproof. This method will train you to beat emotion and stress thanks to method and repetition. Now it's all fine and easy, but when you're starting your exam and your career is on the line, your brain can really play tricks on you. That's why PassU was well prepared for this situation and gave you these life-saving tools. You'll schedule 4 pause moments during the exam. They will have different features and purposes, but the one thing they have in common is that you can check on yourself and review your cheat sheet, possibly saving your life by picking something important you might have forgotten. So once again, pause. You can just give a verbal clue to the examiners as they start to move, like, just 1 second, or I'll check that, stop talking mid-sentence. You're just buying yourself 5 or 10 seconds to skim through the page and see if you forgot to mention anything, especially the additional words you always forget. This is the moment when you look for them. If you find something you didn't mention, just push a quick sentence out. If you still though have no time to talk about it, make a mental note and address it in the room. Now it's time to practice. By the time you get to the exam date, this exercise should feel easy and smooth. No pauses, no stammering, no panic. If you do panic, you just need to practice more. Write down a possible patient scenario and talk your script in less than 5 minutes, ideally 4, to leave room for mistakes. Always practice with the cheat sheet in front of you, unless you're driving. The cheat sheet needs to be glued to your hands. Pushing yourself to remember things without reading is fine, but you run the risk of forgetting to actually look at the cheat sheet during the exam, and you cannot allow that mistake to happen. I know you might want to demonstrate to yourself that you're able to remember every single thing, but the assessment structure allows you to have this massive help through the exam, and you need to use it to your advantage. The two of you need to become one single entity. The more you practice, the more smoothness you'll achieve, which will save you time and stress too. Even though reading all the points of the cheat sheet is fine and will get you to tick all the boxes, ideally you want to talk and run through the topics with more of a conversational style. In fact, you might realize that you'll be jumping between the words of the cheat sheet quite a lot, mentioning the items as they come to your mind. This is a sign that you're mastering the presentation. Awesome. However, this is also the time when we forget things. That's why the pause moment is so important. Be quick, Find your style of presentation, but always check on yourself at the end and add what you left behind. Before I go, I'll give you a demonstration on how to conduct a presentation. You'll judge by yourself. I'll use a hip replacement scenario I just made up. This is how your presentation should sound like once you've practiced enough. In this module, you learned how to plan your presentation to get an astonishing start, ticking lots of boxes even before you meet your patient. In the next module, you'll learn how to conduct a perfect interview in less than 10 minutes and put the foundations for a great assessment and treatment. Before I go, I'll give you a demonstration on how to conduct a presentation so that you can judge by yourself. I'll use a hip replacement scenario that I just made up. And yeah, this is how your presentation should sound like once you practice enough. All right. Hi. Today our patient is Mary. She's 70, and from her file we can see that she had her left a total hip replacement in her left side 8 weeks ago. The GP referred her to us, and because he was concerned about her limping and the management at home. From the file, we also understand she lives with her husband, but seems that they're coping well with doing things at home. And she has emphysema and diabetes, but it's managed apparently well with medication. So basically, we can expect, from all of this that she probably has pain, being 8 weeks and after surgery, and difficulty walking or engaging with stairs or doing her daily life activities at home and participating, doing her hobbies. We'll make sure firstly that she has no issues with maybe surgical complications or any checking for DVT. In general, there's not much information, so I'm a little bit concerned, about, we don't know if she actually had a review with the surgeon, if she's seen any physiotherapists before, how was her discharge, if she's following, an exercise program given by the previous physio, or obviously, if she's following still the precautions for total hip replacement with, in general, the rotations, the adduction past the midline, and the flexion past 90 degrees. Exercises, and during the interview we'll ask about emphysema and diabetes, if somehow they're affecting her recovery, how she's doing with pain and the medication, if she's taking any. We know that she's doing okay with her husband at home, but we want to double check her situation at home, if she needs any help around the house, or taking care of herself, because we can then give appropriate referrals to maybe an occupational therapist if the modification has been done or not, or to social services. And I would like to ask her about her interests, her hobbies, if she's anything that she's not been able to do yet. There's no mention about if she's using any aid either, so we'll check on that too. It's very important for us, at this level, to this moment, to get the treatment pretty safe. So we'll check the strength and the mobility of the opposite hip, but also the knee and the ankle, and then we'll check the contralateral hip, and then we'll check also the mobility of the knee and the hip, obviously on the left side, and the strength of the hip and the knee, of the muscles. We'll check the red flags too, especially as we said about just in case DVT, if there's any issue with that. So depending on the assessment findings and her goals, we'll create a treatment plan together, and so that we can help her get better. So just a second, we'll make modifications as we go, depending on her case, and we'll prioritize, her needs, and also, acknowledging, what the GP told us about the limping and the management at home. So probably we'll start from there if we can.